The word. Thank you for the support given to you as well as by your amazing team to the Urban Strategic Planning Committee during our lifespan. So thank you so much. I would now like to move on to our special input or specialist input segment of the session. I'd like to welcome Dr. Tolullah Oni, who will moderate the session. Dr. Oni, I must say it's an absolute pleasure to be in the company of a next Einstein Forum Fellow, as well as a World Economic Forum young leader. So Dr. Oni, over to you.
Thank you. Thank you so much for the kind introduction. Happy World Health Day, everybody, and happy Earth Month. My name is Tolullah Oni. I'm a public health physician and an urban epidemiologist focused on harnessing cities' natural and built environments for health. So it's a real honor to be part of this conversation in a small way. It's even more of an honor to introduce the two keynote speakers, which I will do in turn. But before I do, I want to contextualize my frame of mind. I just came off a conversation with Eliane Wanjiku Klistun Gitai, who is an 11-year-old climate change ambassador from Kenya. Since the age of 4, she has, up until now, age 11, she's planted over 1 million trees. She's set up an organization called Children with Nature, just harping on about the importance of trees and why we should all care much more. And I've spent the last 2 hours chatting to her, and I'm catapulted into this conversation. So I'm really excited to hear what you have to say. See if you can motivate even more than this incredible 11-year-old, because, and particularly leading me to the first speaker, because the potent power of youth to harness our imagination and to shift norms, to protect their health, but also for them to drive us into action in protecting the planet. So on that note, it's a real privilege to introduce Dr. Karen Obrecht, who is a psychiatrist, a senior consultant psychiatrist, working on obviously mental health and well-being. Dr. Obrecht has worked all over, including in Australia. She's worked extensively with refugee and immigrant populations in Australia and the UK, as well as Europe, and has extensive experience in mental health, mental illness. So Dr. Obrecht, just to hand over to you, I'd love to hear your thoughts from your expertise on green space and our mental health, and particularly if you can, focus on children and adolescents. So over to you. When you're ready.
The most quoted quote, unmute.
Yes.
Anyway, sorry for that. Thank you for your very kind introduction. I'm calling in from Australia. You can see on the photo here, I think, do we upload it here, Sarah? Thank you. So you can see on the left-hand photo a very iconic place of Australia, Bondi Beach in Sydney, where I live, and along with my fellow residents regularly enjoy this beautiful public space. During lockdown, it looked rather uniquely empty, as you can see, but living in this relative affluent area, we were privileged to still enjoy our parks and our leafy backyards. This is in stark contrast what you can see on the right-hand side, where people lived in public housing towers. And that is an example from Melbourne, where these towers were locked, where people were locked down. They were not allowed to come out for about 5 days, only in an emergency, and they were given food parcels. And it was controlled, as you can see, by police. This did not only revoke a lot of PTSD amongst people who survived a trauma in other countries, but it also was a breach of the human rights, and that was acknowledged, but no apology from the government followed. So here you may already assume that people who live in these neighborhoods are less well off. Here live the most vulnerable groups of our society that suffer disproportionately. These groups are usually more affected by pandemics. We know nowadays that, for example, ethnic minorities in the UK and Britain and in the US have higher rates of coronavirus. They also die more often, and they have many more mental health issues. Aboriginal people here in Australia, they are more at risk, as well as the unemployed who live in these areas, as well as people with a psychiatric illness and drug and alcohol issues. So, and I would not like to forget women who suffer most under lockdown condition because of domestic violence. Where these people live, the houses are often of poorer quality, and also there are fewer public spaces available, as the research shows us. This is where the majority of my patients live. The point here is that restriction cause more mental health issues in people of socioeconomic lower backgrounds than they do than they cause any problems for the average citizen. I know we all suffer with mental health problems, but I want to stress that this is a also social problem. So here you can see mental health disorders. There are about 800 million people in this world suffering this. So 1 in 10 at the moment. This is maybe an underestimation, but I think you can see as well that it is increasing, but it is only in absolute numbers because of the population growth. Interestingly, between 1990 and 2019, the mental health disorders actually stayed relatively stable. There was a bit of an increase in some countries. For example, teenagers in the US have more depression, but on the whole, mental illnesses did not increase. However, at the moment, with COVID, we expect a real tsunami of mental illness. And unfortunately, the young are affected disproportionately because of the mental illnesses starting between 20 to 30. And also, as you may know, they are or have often a recurring course. So what have cities and mental health to do with each other? Many studies now point towards the fact that cities have higher rates of mental illness. So born and raised in the city means that you have up to 50% higher chance to suffer with depression. And this is despite all the better services available in cities. But I cannot explain you this urban-rural gradient, as there are many theories around. One says it is because of people have reduced exposure to nature, and this is certainly part of the story, but not the whole. So what about, can I just, this graph you may think this is a bit outdated because it's from 2006, coming from the UK. But what it says, it actually shows you the relationship between environmental conditions and health. The more you go to the left into the least deprived areas, people have less comorbidities and they live longer. So the more you go to the right of this graph, the more comorbidities, both mental and physical, they have, and they die earlier. So this is an urban-rural gradient, this is a social gradient of health. And this is not what we learned in psychiatry or in the past in medical school. It's not the genes that drive these comorbidities, these many illnesses. It's the social determinants of health. So what do we know about green spaces and the benefits of them for the population? So we know that, for example, there's a lot of research these days. A review showed for children, for example, that there is improved mental well-being and better cognitive development with increased access and of green spaces, and also if they are more in the vicinity. There are also better physical and socio-emotional health for students who live with green schoolyards. This is a very easy intervention, and there is a movement of greening schoolyards here, at least in Australia. And and it would be a very cost-effective intervention in all countries, not only the developed one. In adolescents, we have a multitude of positive outcomes when they have increased access to green space. But also in the elderly, I would like to stress that there is a good evidence for long-term exposure to green space and healthy aging. So in fact, even the cognitive function is better. So probably less dementia. They have also less physical issues and better mental health. In a street view of green and blue spaces, there is a protective, this has been shown to be protective against depression. And also even tree covers around nursing homes seem to be related with less depression. So there are many, and I think I had another slide. I'm sorry that I had these slides, but there were a lot of other examples for adults where there is a clear and the causal association was already found between mental health benefits and access to long-term exposure to green spaces. So, and probably I just highlight as well a really important study at the end. It is a study, a longitudinal study from Sweden, where about 900,000 people were interviewed. And it showed that children who grew up with the lowest levels of green space actually had up to 55% higher risks of developing a psychiatric disorder. So there is a clear relationship between the prolonged presence of green space in children when they are growing up and their later risk of developing a mental illness. So I just want to end with, as a doctor, I can only reach out to a few people with mental illness. But as policymakers and urban planners, you have the unique opportunity to prevent mental illness on a grand scale by building valuable public spaces in the cities and of the present and the future. You can play a major part in tackling the ongoing inequalities in mental health within countries and between countries. Thank you.
Thank you. Thank you so much, Dr. Obrecht. I think that was a really clear and strong case connecting the access to green space and public and mental health and the importance of prevention. Thank you for highlighting that. So coming on to what can be done about it, it's a pleasure to introduce Ethan Kent. So Ethan has been working for over 20 years supporting public space organizations, and a couple of years ago established Placemaking X as a way to amplify and accelerate these kinds of public space initiatives across the world in over 900 cities he's been to in over 60 countries. So Ethan, I would love to hear about the work that you're doing as part of Placemaking X in essentially preventing mental ill health through public space intervention. When you're ready, Ethan.
Thank you, Tolullah. Great. And thank you, everyone, for being part of this. I want to particularly thank our colleagues at UN Habitat, UCLG, and Metropolis for hosting this really important conversation, and for their longtime leadership on public space and the connection to health issues, certainly. Placemaking X is a global network of public space and placemaking advocates, practitioners around the world that are connecting with each other and with other fields like this to accelerate and amplify public space impact. And we launched globally at the World Urban Forum just over a year ago with some of you. And of course, little did we know that this year would highlight the importance of access to public space and certainly the issues around lack of access to public space, more than we ever could have imagined. Of course, this year has also, amplified and helped people understand, our whole range of health issues, our awareness of how our health is interconnected locally and globally. And then we're seeing how people are understanding how health and public space issues connect to each other, and how disproportionate access to public space into health care and so forth perpetuate and amplify that disproportionate outcomes for health, as Karen so effectively described. So indeed, we see obesity, depression, a range of health issues. Some of the, mostly that Karen mentioned, are caused by a lack of, or exacerbated by a lack of access to public health space. And in our that disproportion is correlates with income and with race issues. Certainly, as we've seen, particularly here in the U.S. over the last year, the health-related issues, both as it correlates to COVID, but also to other issues of feelings of safety and of ability to have mental health and access in that regard. And then, of course, increasing studies, and Karen also alluded to a lot of this, show that place and one's postal code is the greatest predictor of health and longevity, a whole range of health outcomes. But at the core of many of these health issues is a disconnection between people. We've long seen sort of the disconnection between people and also between people and place as underlying many of these health issues: loneliness, depression, obesity, and it's not just from each other, but it's from our places, and it's also we're feeling disconnected from our agency to shape our communities, to shape our places. Where people we're at sort of a low point, perhaps, in history of our ability to create and shape our public spaces, and therefore shape our health outcomes. But this moment is also, we've seen a lot of positive things over the last year. We've seen a lot of innovation, a lot of reconnection to public space, to each other, to our communities. And this crisis has reminded us of the value of public space. We've appreciated the public spaces that we do have access to all the more. We've often contributed to them and helped improve them around the world. We've seen how a cycle of adding to public space and connecting to our community can help build each other back up. Place and people can build each other up as much as we have torn each other down. And we've seen that the most effective solutions for public space are often quite affordable, quite simple, quite intuitive in many cases. Doctors are recommending walking. Public spaces need more people walking in them. Karen, illustrated the need for nature and green space and its effect on mental health. This again is something that many of us have access to or can have access to, and it's not necessarily that expensive in many cases to support more of that. And then just in being part of our communities, being part of our social life isn't expensive. Slowing down, talking to people, smiling at people, making eye contact. This is something that as we've been part of our communities, this year, people are appreciating more of and learning to contribute to. We've also seen, investments in public markets, outdoor areas, and all kinds of placemaking, often through what we call a lighter, quicker, cheaper approach, as gaining appreciation, gaining capacity for communities to implement this type of work. And I want to mention sort of a few different areas that we're seeing this innovation, this leadership in. The first is in informal communities, and we actually did a webinar with some colleagues from UN Habitat on innovations and impacts for public space in informal communities, showing how people are reclaiming public space, improving the safety of it, adding facilities for hand washing and so forth, but also for access to mental health and other health care opportunities, and to healthy food and so forth through markets. But I'll put the link to the webinar and all the resources and actions that can be taken for improving public space and healthy communities in the chat later. Tourism is an area that is perhaps been most affected by the pandemic, but we've also seen a long need to reinvent tourism and for us all to be tourists again in our own communities, and then to, as things do open up, to invite tourists back into our communities in ways that add to them, to not just market an extractive approach to tourism, but to invest in places that are for and by local communities, that encourage our local communities and visitors to participate in them in a way that contributes to them, that where they slow down, smile at people, have a deeper, more authentic experience, spend money in ways that contribute to and add to the local culture and identity, and so forth. And the last area I'll mention is, of course, transportation and how we're treating our road space, our street space, and that's really the biggest change we've seen around the world, especially here in New York, and in Brooklyn, where I am. In New York, we've reclaimed open streets, dozens of them around the city, and we have over 10,000 streeteries where restaurants have been allowed to take over parking spots. And now retail and street vendors are also being allowed to use street space in ways that add to public space for the most part. It's been an iterative, sometimes messy approach, but that's where the creativity is, and these are ideas that we've been advocating for decades, and now finally we're seeing much more creative use of our street space. And frankly, it's the destinations, the districts, I've seen it around the world, but also especially in New York here, that are reclaiming their street space, that are creating these open streets, that are the ones that are surviving and thriving most through the pandemic, and I think will come out of it most strongly. These are the districts where each vendor, each restaurant, each retail business is contributing to the public realm in ways that benefit everyone else. And those districts are becoming destinations citywide. They're places that will you won't necessarily open back up to cars. You drive to, not through. So we're seeing an opportunity to reinvent our cities, our transportation systems around districts and destinations you go to, not through, where we pedestrianize and open our streets to people. And that's starting to create this sort of virtuous cycle of places that people connect to, feel safe in, have great mental health. I mean, these are some of the most healthy, socially vibrant, diverse places in the city right now. So just sort of to close, I'll say that I think we need to sort of, this is a once in a lifetime opportunity for us all to really turn upside down the shaping of cities, to start with public life and our connection to places. To start with places that people feel healthy in, that people feel social connection in, that we build social resilience in. To start with the goal of human connection and happiness. And then how do we design the governance, the policy, the urban design to support these outcomes. But a lot of these things can be done in the short term and the low costs. And we're seeing how, our health reflects our public space, and our public space reflects our health. It's time to sort of put into motion this virtuous cycle of us all contributing to our public spaces, having that build our public health, our mental health, and having our mental health and public be able to obviously contribute back. So it's something we all can do small things to contribute to, and just how we interact in our communities, and to kickstart that. But we're also developing campaigns and toolkits to scale up what placemaking can be, from the small scale, from the lighter, quicker, cheaper, to what we're calling place-led development, to anchoring and driving the market for better development with public spaces that are accessible and equitable and healthy. So anyway, I look forward to working with all of you to figure out how to seize this moment, and to collaborate more passionately, aggressively, in a more globally connected way. And that's through these networks is the only way we can get this change to happen. So I appreciate all of your work to do this on every scale. Look forward to the conversation. Thank you.
Thanks, Ethan, and thanks for pointing out the importance of having public space that is accessible, equitable, and healthy. If I may, in like 30 seconds, I would add to that public space that is climate resilient, and I would like to you and Karen, if you can have a 15-second intervention, right? Because I do think we have to insert climate into every conversation that we have at the moment, rather than as a separate conversation. So we're talking about public space. We know that the climate change realities are, driving extreme weather events that impact public space. We have extreme temperatures that impact our ability to use public space. We have flooding. We have increased outbreaks and zoonotic infections. So there are all these things that disrupt both our public space, our ability to use that, as well as our mental health, because we know that there's associations between the climate change outcomes and mental health. So in 15, 20 seconds, can each of you just give your perspective on the ways that we should be integrating how a climate action into our work on public space and mental health? Karen, would you like to go first?
Okay, yeah, that is I think it needs to be done by everyone. I think the most important bit is to gain people actually for the idea of public space and reconnecting, and particularly in the face of climate change. I think if people are not involved, and that means from the children to the elderly, they are not interested and they will not appreciate what is being done for them. Right. I mentioned the schoolyard greenings, and I think involving the children in that, as I have seen here in some schools, would be a good initiative for already.
Fantastic, thank you. So inclusive participation from you. Ethan?
Yeah, thank you, Tolullah, for bringing this up. Most important. Certainly, the placemaking movement actually grew out of the environmental movement in many ways. My father actually organized the first Earth Day over 50 years ago here in New York. But we've always seen the placemaking movement is about connecting and drawing together many different causes and issues to ramp people onto broader environmental stewardship. And while the environmental movement seems sort of abstract to many people for a long time, placemaking is about how do we connect change and opportunity for having an impact to the areas right in front of our homes, to the local, to the small things that we can all do, and scale up that stewardship, the sort of sense of ownership and agency that's needed to tackle our biggest climate our biggest challenges with climate being at the top of them. So certainly the earth is not healthy right now either. That's the bigger challenge, perhaps. There's you've seen the graphics that show that it's the crisis after COVID that's actually much bigger, that we can't ignore. But we need to use this COVID crisis to reconnect to our local environments, to create healthy local environments and scale up our ability to collaborate and connect the innovations, the solutions globally. So these are all connected, and this is the time to see our global connectedness, all of us, to take on these challenges in a collaborative, creative way.
Great, thank you. So collaboration and connection, both between ourselves and between these interdependent and interlinked issues. Thank you both so much for those keynotes, and really to hit setting us off and setting the scene really nicely. You've painted the importance of governance and inclusion and participation, but obviously governments have a really critical role to play in public space. So with that, I will hand back to Pooven to lead us into the next session on the role of local governments.